Refractive error is a very common thing amongst the population. But like if we consider the eye, each and every structure, most structures in the eye, like the cornea, the lens, all these are refractive medium. So the what our eyes does is they focus the outside light onto the retina. So when this inherent ability to focus the light onto the retina directly is disturbed, so in that case we have the refractive error. So the rays get focused either before the retina or after the retina. So they are not getting focused directly on the retina. In such cases, we have refractive error. When we talk about the types of refractive error, we have myopia, we have hypermetropia, and then we have astigmatism. Other than this, above the age of 40, we have presbyopia, which is nearsightedness. People have difficulty in reading distance. Near vision is hampered. In that case, we call it as presbyopia. But basically, it is not a refractive error. It is due to a defective accommodation, with age the accommodation power reduces. So it is due to defective accommodation that we are having presbyopia. Refractive error per se does not cause blindness, but the allied diseases which are associated with refractive error may cause blindness. Like, for example, a high myope has more probability of having a lattice or a retinal hole. So, such retinal hole may progress and finally cause a retinal detachment, maybe due to a minor injury, or maybe fine morning, he's just getting up and he's seeing certain floaters in his eyes and flashes in his eyes, and he neglects it, and finally it goes on to develop retinal detachment. In such cases, if the attention is not given on time and the ophthalmologist does not see it on the time, then it might lead to blindness. We should ensure that we always tell parents that before the age of 5 years, always get your children's eyes checked. Be it having any due to any symptom or not, your refraction must be done before the age of 5 years. Because children often don't know that they are not able to see, or they cannot complain. They do not realize that they are supposed to see this and they are not seeing this. So you won't have the symptoms when an adult comes to you and he tells you that I am having this symptom, I can't see this far. The child doesn't know that he's supposed to see that far. So whatever he is thinking that it is fine. I'm supposed to see this much only. Often we discover that when the child comes to us, maybe late by 7 to 8 years, we realize that maybe he's having a high refractive error and it wasn't diagnosed on time. And in such cases, what happens? Maybe he would not become blind, but maybe the eye which is having a higher power or a higher astigmatic error becomes a lazy eye or amblyopia. So the vision does not come up to the mark, maybe up to the other eye, exactly up to the other eye. Maybe he's not seeing as far compared to the other eye. Causes of refractive error. Firstly, we must keep in mind about the genetic component. Genetically, like when both the parents are high myope, the children are already predisposed and are having a higher probability of having myopia. So in such cases, we nowadays we are having marital counseling regarding the problems of having issues in high myope. Then again, we have environmental factors, we have nutritional factors. So high nutritious diet is important, and most importantly is outdoor play. Nowadays, studies are saying that minimum of 1 hour to 2 hours of outdoor play is essential. Since the use of mobile phone has become so rampant nowadays, studies have shown that prolonged use of mobile phone are having children being predisposed to higher refractive errors. And more so, I would say regarding mobile phones, a child watching TV is still okay, rather better than watching something in a mobile phone, because TV is at a certain distance. But when he is watching the mobile phone or seeing something on the mobile phone, his near work is being enforced. So the chances of esotropia, or the chances of developing refractive error becomes very high. So children, parents must keep in mind this is really important. Nowadays, the mobile phone has become like a addiction for most of the children. So parents must keep in mind that regular outdoor play is very essential. when we talk about adult patients, they come with symptoms like having headache, prolonged headache maybe, and inability to see at a certain distance, or maybe having tired eyes by the end of the day. Maybe when he's starting off in the morning, he's fine. By the end of the day, he's feeling tired. Eyes are getting tired. But in children, they are often not able to explain what their problems are. They say that like they may be saying like I can't see the board while in classroom. Then again, in case of toddlers, they may be rubbing their eyes frequently. They may be blinking their eyes frequently. So all these symptoms must be borne in mind, and they must raise an alarm regarding refractive error. Refractive error is treated mainly by glasses. We prescribe the glasses, and if it is progressing, like in myopia, there have been studies where the child is having progressive myopia, then certain drops may be given to reduce the rate of progression. It might not be withheld completely, it won't stop, the progression won't stop, but the rate of progression might be decreased a bit. Then again, when patients are not willing to wear glasses or spectacles for long hours, we can prescribe contact lenses. But provided the hygiene factor must be kept in mind, contact lens care is very important. Care must be taken, the solution must be changed, the contact lens must be changed. All these factors must be kept in mind, and so we always prescribe contact lenses to young adults. Very old people, they may not be able to change their contact lenses or wear it on or dispose it on time. For children, it might not be possible. So contact lenses is one of the options. Other than this, we find young adults who are wanting to dispose of, wanting to see without their glasses. So provided the refraction has been stable for certain amount of time, then we can go for corneal refractive surgery. In general terms, we call it as LASIK, but this cornea must meet to the prerequisites required for LASIK. Then we can go for the procedure, and maybe he can be off his glasses for lifelong. Refractive error per se may not be prevented. It's difficult to prevent it, but most important thing is diagnosis on time. The patient must come to the doctor and ophthalmologist on time, and especially parents. I reiterate it again, parents. Do not neglect any symptom in your child. Maybe your child is rubbing your eye. Maybe he is having recurrent infection in his eyelids. Maybe he is blinking too much. In certain cases, like a child will tell you that I am not able to see far up to the board maybe. So do not neglect it. Bring the child to the doctor. Diagnose it early. Early diagnosis is the main thing. And other than that, nutritious food and outdoor play. And then again, nowadays it might not be due to it might not cause refractive error per se, but nowadays very frequently what we find is computer vision syndrome. We have many IT professionals who are working for long hours on the computer, and so their eyes get strained, and they are having some astigmatic symptoms. In that case, we tell the patient to follow the 20-20-20 rule. What is the 20-20-20 rule? So after every 20 minutes, we ask them to look 20 feet away for 20 seconds. So where do we look? We look outside. 20 feet away, like we look outside the window for 20 seconds. And then again we can come back to work. So this might not prevent the refractive error, but this will reduce the symptoms of computer vision syndrome and reduce the tiredness of your eyes, and you can work better on your computer for a longer hours.